welcome back to Bottles, Boobs, and Feeding Tubes. It's me, MPT, your partner from Bump to Baby and Beyond. Today we're going to talk about weight gain in pregnancy. I know everyone's always trying to worry about how to lose the weight, but this is a time where we learn to gain the weight, how much weight, and how we can fuel our baby and our bodies for this journey into creating a baby and then delivering the baby. So when you think about gaining weight, this may be stressful for some, especially if you've been trying to lose weight, if you've struggled with weight your whole life, or if you even have a history of an eating disorder and gaining weight may be a trigger for you. So we definitely want to make sure we're eating healthy for the baby, not necessarily focusing on the scale so much, but just how your body feels, the foods you're getting, and how you're staying healthy during this time period. Why does it matter if you gain weight while you're pregnant? Well, one, you're creating a whole human being. So as you're growing this new baby, and the organs and all of that are developing, you are also creating the environment. So the weight gain, the foods you eat, creates the placenta, the amniotic fluid, the baby's development, all of the things that are needed to keep the baby well fed during this journey. You're also increasing your blood volume. So you're making more blood that is going to travel from you to the baby, where it delivers all the nutrients through the umbilical cord. And that's how the baby stays healthy. There is a guideline for the recommendation for gaining weight, whether you're underweight, overweight, you're at weight. You would want to check with your provider about that right amount, because it may vary. You may be underweight and your provider may tell you you need to gain 20 or 30 pounds, whereas you may be overweight and your doctor may say, don't worry about gaining the weight, just make sure you're eating properly. And sometimes women do lose weight during pregnancy, especially in that first trimester. If you're having a lot of nausea, vomiting, you can't keep anything down. So if you're experiencing that, you may want to talk with your provider, your midwife, and sometimes you may need additional IV hydration if you're getting dehydrated. So those are different scenarios and things that may occur as to why weight gaining is harder for you, or you may find that you're gaining a lot of weight and you're getting overwhelmed because you're like, okay, I just gained 100 pounds in this pregnancy, and you're feeling all types of way about yourself. But as long as you're healthy, baby's healthy, and your provider isn't concerned, just keep eating as you would for your baby and making changes as directed. You want to make sure you're eating nutrient-dense food, proteins, a lot of proteins, fruits, vegetables, things that are high in vitamins, iron, folic acid. You may be told to take certain supplements such as a prenatal pill with folic acid, depending on your risk factors for neural tube defects developing. That's all based on your provider and you. So make sure you're eating, like I said, lots of protein wherever you consume your protein. Vegetables. Make sure you're getting a lot of fiber to help with digestion, because constipation is a symptom of pregnancy. Not something I knew about. So for someone suffering with chronic constipation on top of pregnancy constipation, so fiber will help keep your bowels moving. You want healthy fats. Fats are good. I know all of the commercials and the diets are telling you to get rid of fats, but healthy fats are good because that helps with the development of the brain. How to approach a healthy weight gain: make sure you're eating balanced meals. If you have a lot of nausea, you may want to eat smaller, more frequent meals. Hydration. Stay hydrated. Make sure you're drinking plenty of water. Caffeine, they will tell you to limit that, so you may want to start working on cutting back on the caffeine, but make sure you're staying hydrated and drinking plenty of water. If water is hard for you, you may want to add some fruit or lemon, strawberry, something in the water to give it a natural sweetener and flavor for you. Risk of gaining too much weight: you can increase your risk for having high blood pressure, gestational diabetes, a large baby. Not gaining enough weight: you may have a smaller baby. There is possibly some risk for premature labor. I wouldn't stress too much if your doctor wasn't really concerned about it, but those are some risk factors with not gaining enough or gaining too much weight. This is not a time to go on a diet, so you can wait 10 months, figure out your whole diet, but this is not a time to try to be like, you know what, I could lose 20 pounds maybe in this first trimester. I just won't gain those 20 pounds. And no, it's not the time for that. It's the time for you to be healthy and your baby to be healthy. Listen to your body, eat things that are good for you. I know you're gonna have some cravings and it's okay to give in to those cravings, but make sure you're also giving your body those nutrients it needs. So those are some tips to healthy weight gaining during pregnancy. Make sure you're fueling yourself, your baby, and your brain. Make sure you consult with your provider if you have any concerns with your weight gain. Thanks for watching. Don't forget to like, comment, subscribe, and watch some of our other videos. Thank you.